Hello. Next, I'd like to speak about radiation injuries. You need to know the two different types of radiation. There's ionizing radiation and non-ionizing radiation. Ionizing radiation is what I want to talk about here. That's the stuff that damages DNA. This is the things that prevent normal cell replication and cause cancer long term. I'm speaking here about X-rays and gamma rays. Non-ionizing radiation is mostly what we mean by heat. Thermal injury includes microwaves, infrared, and ultraviolet. Two other concepts you need to know for the tests are the difference between radiation exposure and radiation contamination. Radiation exposure means that X-rays have gone through your body, you have been irradiated. However, you are not radioactive. That is, there is no radioactive elements on your skin or in your body that will give off future electromagnetic radiation. In other words, this is the typical scenario in someone who's had an X-ray taken, right? You've been exposed to radiation. Radiation contamination, on the other hand, means that there are radioactive substances either on your skin, external contamination, or incorporated into your body, internal contamination. When you have radiation contamination, you are radioactive and you are actively emitting ionizing radiation yourself. Okay? In this situation, you will trigger a Geiger counter as the radiation is emitted from your body. Okay? So this has obvious concerns for treatment. Patients that have radiation exposure but are not contaminated, they can be brought into the hospital and treated like any other patient. Patients who have radiation contamination, however, they need to be segregated and they need to be quarantined essentially and kept away from the rest of the hospital. Otherwise, the whole hospital will be irradiated and might become contaminated as well. There's a little bit of physics here you need to know. We have to go over the difference between RAD and REM. Okay? RAD is the radiation absorbed dose. That's what RAD stands for. All right? And REM refers to its effect on biological tissue, the Roentgen equivalent man. All right? These two are related by the following equation that's shown. REM equals RAD times the RBE, where the RBE is the relative biological effectiveness. All right, now this all sounds very complicated, but you know, it gets a little easier because for all electromagnetic radiation, that's all X-rays and gamma rays, the RBE equals 1. So essentially, the units are equivalent. 100 rad is also referred to as 1 gray, and 100 rem is also referred to as 1 sievert. So the total amount of radiation you're exposed to is dependent on a couple of factors. Most importantly is how powerful the radiation source is. Next, you want to know how close the patient was to the radiation source. The closer you are to the source, the more ionizing radiation you would receive. Of course, the time exposed is important. And then any shielding. If you're wearing a lead shield, you'll be protected. So I want to speak about the situation now to give you a case of someone exposed to whole body radiation where they are not contaminated. All right? If you're at 0.15 gray exposure, you have no clinical symptoms. However, if you looked at the lymphocytes, you would see some chromosomal abnormalities. A half a gray, you'll have a decrease in your white blood cell and platelet count, but not to the effect of causing neutropenia, neutropenic fever, not to the point of causing bleeding from a low platelet count. Starting at 1 gray, you're into some more serious symptoms, with many people having nausea and vomiting. Okay, and as you increase your radiation, your white blood cell count's going lower, your platelet count is going lower. By 2 gray, everyone is at least half the population is having nausea and vomiting, and there's marked defects and decrease in your white blood cells and platelets. Now, as you increase the radiation dose, there's more vomiting and more beginning to have diarrhea. You'll notice that the radiation most acutely affects cells that rapidly divide in the body. Okay, so this is the lining of the intestinal tract, the gut. Those are damaged. You have diarrhea, bloody diarrhea, electrolyte imbalance, dehydration. And they affect the blood lines, so decrease in all 3 blood lines, the white cells, the platelets, and the red cells. By 4 gray, this is very serious exposure, and untreated, half the patients will die. This is a dose that will also cause sterility in men. Once you get above that, the patients are very ill very quickly, within minutes, and almost uniformly fatal. The bone marrow is the most commonly affected system with whole body radiation. So you could imagine that most of the deaths are from leukopenia and neutropenic fever. The platelets being decreased makes you more prone to bleeding complications. Combine this with the fact that there's lots of diarrhea from sloughing of the intestinal mucosa, you could imagine that bloody diarrhea is a big symptom with radiation sickness. Okay. If the patient survives, there could be long-term changes to the skin, thyroid cancer is more likely, and some lung damage is also possible. So prevention here is the key. If you have someone have radiation sickness, what are you going to do, people that have had whole body radiation? Well, it's airway, breathing, circulation. It's supportive care. It's correcting the fluid and electrolyte and acid-base status of your patient. Certainly, you can use standard antiemetics to decrease the nausea and vomiting. Follow the platelet and red blood cell counts and transfuse as needed. Now we could use granulocyte colony stimulating factor and granulocyte macrophage colony stimulating factor as needed to increase the cell lines that have been damaged by the ionizing radiation. Antibiotics are not given prophylactically. Antibiotics are given for the same standard indications as anyone else who had neutropenic fever, just like a cancer patient. But without fever, neutropenia, and no other indication for antibiotics, don't give them. Lastly, if you see a choice of someone who's not improving and failing standard therapies, you could even consider bone marrow transplant in these patients. Now I want to talk a little bit about radiation contamination. Here the key is not to let the patient into the hospital. Outside you'll set up decontamination stations where radioactive clothing will be removed. Patients that have radioactive elements and substances on their skin will be washed down and the wash water saved and segregated from the rest of the water supply. Okay? And then only after they are no longer radioactive, giving off Geiger counter clicks, then they can be admitted to the standard hospital and treated for their radiation sickness or radiation exposure. If you don't do this, the whole hospital is going to become contaminated and the whole healthcare system will shut down. With nuclear detonation, with dirty bombs, there's going to be a need for a large amount of potassium iodine, also known as SSK eye drops. And the purpose of this iodine is to prevent the uptake of radioactive iodine-131 and iodine-125. This will prevent the long-term sequela of increased incidence of thyroid cancer. That ends our discussion on radiation injury. I've listed a reference from the government on radiation contamination. You don't need to read this for Step 2 CK. I presented the material you need, but if you want further information, this is where to look. Thank you.